What was healthcare like before government intervention? Imagine a time when going to the doctor wasn't about insurance plans or government programs, but about community and personal relationships. Before government got involved, healthcare in the United States was mostly local and driven by individual effort. People relied on family members, local healers, or individual doctors who often knew their patients personally. There were no large hospitals or universal insurance systems. Instead, most treatment happened at home, especially among middle and upper-class families who could afford it. Hospitals, which we now think of as standard, started out as places for the poor or the socially disadvantaged. They were often just old buildings called almshouses or pest houses meant for quarantine, not healing. Medical practice was just beginning to become professionalized in the 1700s and 1800s. Medical schools and societies started to form, which helped standardize training for doctors. But access to health care was very uneven. People in cities had more options and better care than those in rural areas. Hospitals slowly evolved from places for the poor into centers of medical treatment, but they still weren't very advanced or widespread for much of the 1800s. Health insurance, as we know it today, did not exist before the 1900s. The first prepaid hospital plans appeared in the 1920s and 1930s. One example is the Blue Cross plans, which helped hospitals stay afloat by offering affordable inpatient care. Doctors also created their own insurance plans, called Blue Shield, to cover services outside hospitals and protect their income. Public health efforts were mostly local or state-based, focusing on sanitation and controlling diseases like cholera or smallpox. The federal government played a tiny role, mostly helping specific groups like merchant sailors. The idea of government-funded or mandated health insurance was suggested early in the 1900s but faced strong opposition from doctors and other stakeholders who wanted to keep healthcare a private matter. From a libertarian point of view, this era shows a system where voluntary exchanges, private initiatives, and community support shaped healthcare. Without government rules or mandates, competition and innovation could flourish. But it also meant that access was uneven, and many people, especially the poor or those in rural areas, couldn't get the care they needed. Libertarians argue that government involvement has often made healthcare more expensive and less personal. Today, reform ideas from this perspective focus on reducing government control and encouraging private solutions that respect individual choice and market forces.